Hello everyone, welcome to the Lifestyle is Medicine podcast, a weekly podcast on how a healthy lifestyle is medicine. I'm Daniel Cho, Managing Director of Pathways to Wholeness Lifestyle Medicine Center, and I'm here with Dr. George Cho, Medical Director of Pathways to Wholeness and the North York Lifestyle Medicine Clinic in Toronto.
Hello everyone.
So today we're going to discuss a study out of the Harvard T.H. Chan School of Public Health that's hot off the press and receiving widespread media coverage in the US, Canada, and around the world. It was published in the journal Circulation, and the title of the study is Impact of Healthy Lifestyle Factors on Life Expectancies in the US Population. And as the title suggests, it's a study that shows a strong link between healthy lifestyle factors and longevity. Dr. Cho, can you succinctly summarize the study for us? What's the bottom line of the study? What did they look at? What were their key findings?
For sure. So this was a very large study involving large numbers of men and women. So they looked at one study called the Nurses' Health Study, which examined 78,000 women, nurses in particular, and in the Nurses' Health Study they followed these women for 34 years approximately. And then they also got the Health Professionals Follow-Up Study, which looked at men, 44,000 men, and these men were followed for 27 years. And basically they looked at the lifestyle factors, 5 lifestyle factors, which were not smoking, having a normal body mass index, which they defined as 18.5 to 24.9. They looked at whether these individuals exercised at least 30 minutes per day of moderate to vigorous intensity physical activity, and moderate alcohol intake, and then a healthy diet. And what they're doing was they're seeing whether adherence to these 5 lifestyle factors or achieving these 5 lifestyle factors would impact someone's longevity. And what they found was that compared to those who are not practicing or who are not achieving these lifestyle factors, that those who are following these lifestyle factors, they had longer lifespans of nearly a decade longer than those who are not, and that their risk of dying from various chronic diseases was much lower. This included cancer, cardiovascular disease, and all all-cause mortality.
Yeah, it was a massive study, like you said, thousands of participants, and the Nurses' Health Study and the Health Professionals Follow-Up Studies have been going on for a long time, haven't they? I think it was in the late 1970s for the Nurses' Health Study,
right? And
the Health Professionals Follow-Up was mid 1980s, I believe, is when they started that.
The Nurses' Health Study was in 1980 to 2014, I believe, and then the Health Professional Study was 1986 to 2014, something around there. Yeah,
right.
But many years of following these people.
Right. So it's a massive study, and of course it came from Harvard, and some of the lead authors in the study are really big names in nutrition. I mean, we're talking about Dr. Walter Willett, Dr. Frank Hu. So those are listeners who are familiar with the nutrition area might recognize those names. So yeah, it's been getting a lot of attention. Why do you think that's so? I mean, there's hundreds, if not thousands of studies that get published on a monthly basis. Yet it seems that almost every news outlet picked up on this one. And it's all over Twitter, and so many people are talking about it. Why do you think that is?
Well, I think this particularly grabs people's attention because people want to live longer, right? And not only do they want to live longer, they also want to live longer, healthier, right? So, and this study shows you that by practicing or by achieving these 5 lifestyle factors, that you can avoid getting chronic diseases and you can live longer, and these added years are better years. So I think that's one of the reasons why this study grabbed a lot of attention. And another reason is stated by the authors themselves in the study. In the abstract, they mention how in America, even though America is the wealthiest nation on earth, that when they compare America to other well-off countries, that America has a lower or a shorter life expectancy, right? But then they conclude in the study that by achieving these 5 lifestyle factors, that they can actually start matching the lifespan of other countries that are more well-off. So I think that's another reason why this study got a lot of attention.
One thing that really caught my attention was something the authors said at the beginning of the study. They write, however, the U.S. healthcare system has focused primarily on drug discoveries and disease treatment rather than prevention. So I'm quoting, chronic diseases such as cardiovascular disease and cancer are the commonest and costliest of all health problems, but are largely preventable. It has been widely acknowledged that unhealthy lifestyles are major risk factors for various chronic diseases and premature death. I think they've really hit the nail on the head here. We in the medical community are so often focused on drugs and treating the disease with drugs, when in fact the root issues are lifestyle related. And I think that this study really bears that out.
Yeah, I totally agree. We focus too much right now on band-aid solutions and not addressing the root causes. It's not to say that medication stuff like that aren't important, or addressing some of the symptoms aren't important. They are. But I think one of the reasons why we're failing people in many ways is because we aren't addressing the root causes. And we know that a lot of the root causes of the common chronic diseases of today are related to how we eat, how we move, our alcohol intake, smoking, and these things. So I think this study is really important because it bears out how important these simple lifestyle factors really are, especially when it comes to longevity and reducing the risk of dying from these chronic diseases. So I think this is why this is really important, and it reinforces why addressing the root cause is really important for prevention of these chronic diseases like cardiovascular disease and cancer.
Right. Now let's dive deeper into the study, and before we look at look more closely at the findings, one thing that stood out to me was some of the baseline data. And if you look at the baseline data, and for our listeners, we will include a link to the study on the podcast page so you can go directly and read it for yourself. But if you look at the baseline data, I noticed how few of the study participants adhered to the healthy lifestyle factors. So, for example, if my calculations are correct, only a little over 1% of study participants from the Nurses' Health Study and the Health Professionals Follow-Up Study adhere to all 5 healthy lifestyle factors. And less than 10% of participants approximately adhere to 4 of the healthy lifestyle factors. Now, conversely, somewhere between 64 to 70%, I think 64 was in the Nurses' Health Study and 70 was in the Health Professionals Follow-Up Study, around there. And if I did my math correctly, 64 to 70% adhere to only 2 or less of the healthy lifestyle factors. Now, these studies were, started in the early 80s, mid 80s, in middle to older adults, but that's very few people who are practicing these. What most of us would probably acknowledge are pretty simple lifestyle, factors or behaviors. What's your sense now? Do you think that more people now adhere to more of these healthy lifestyle factors?
I know those numbers are kind of discouraging, but unfortunately, I don't think that the adherence to these lifestyle factors has increased. Maybe in the realm of smoking, I think the data shows that smoking rates are going down here in North America, so I think that's a positive. But let's take, for instance, BMI. So in this study, they one of the factors was to maintain a healthy BMI, a normal BMI, which was 18.5 to 24.9. Well, we know that the average weight and the levels of obesity and excess weight has been increasing over the years. So and that I think also is also an indicator that our diet is probably not optimal, and our physical activity behaviors is also not optimal either. I don't imagine more people are actually exercising 30 minutes per day. I would say that even less are doing that. So I think the numbers, if we were to look at the numbers of population today, I think it would be even less. So so I think that bears out that we have a lot of work to do when it comes to promoting a healthy lifestyle and empowering people to start practicing these different behaviors and achieving a normal weight and things like that. That's going to help them. So there's a lot of work to be done for sure. And I think studies like this helps in the battle to help people to realize how important these things really are.
Yeah, for sure. And I think that there have been studies to show that obesity really took off in the past 3 decades. So, like since the 1980s, that's when it really started to take off. So yeah, if we consider that one, then and how many people have excess weight in our populations, right? Isn't it something like 2/3 of Americans have some sort of excess weight? And I think Canada might be
too far off too.
Right. I think it's a bit less, but not too different. So the study estimated that following all 5 healthy lifestyle factors could prolong life at age 50 by 14 years for women and 12.2 years for men. That comes out to a life expectancy around 93 for women, 93, and 87 for men. That's more than a full decade of life. And I imagine, what we could accomplish and contribute to the world with another decade of life. And wouldn't it be likely that these additional years would be of better quality as well? And if you're following these 5 lifestyle factors.
Well, I totally agree. I think not only are people adding years to their life, but these undoubtedly are higher quality years. We know that diet, for instance, has a huge influence on the risk for cardiovascular disease, even cancer. Smoking and alcohol have a part as well, physical activity. So if people are practicing these behaviors, they're not going to, first of all, they're going to lower the chance of even getting these diseases in the first place. So these are going to be higher quality years. And even after people get these conditions, there's studies that are coming out that practicing a lot of these same behaviors and achieving a normal weight and things that can also help kind of reverse the course of many of these chronic diseases. So I would imagine that those who are achieving these lifestyle factors, that their lives, these extra added years are going to be higher quality years as well. So I think that's great news for people who are listening, who may have loved ones or who may themselves are struggling with these different chronic diseases.
And I think that's an important point because we know that life expectancy has been going up, especially if you compare it to, say, like the early 1900s, right, where many people died early because of infectious diseases. So our life expectancy has been going up, but many of those years are spent fighting a chronic disease, right? And our improved ability to treat these diseases, it's good, but they're we're prolonging life, but they're not really good quality years. But if we follow these 5 healthy lifestyle habits, it seems that these extra years, if you will, would be better quality ones.
Yeah, for sure. I mean, if you have to take drugs all the time, if you have to make repeated visits to the cardiologist, or there's some people who go through multiple bypass surgeries. I mean, this is not an example of a high quality life if you're going through all this, right? And but people can really take encouragement from the fact that these diseases are reversible in many cases, and also avoidable as well. So this is very encouraging news for people who may be struggling with these conditions. And Dale, I want to kind of make sure that it's clear to the listeners. You had said that the study showed that following the 5 lifestyle behavior or factors could prolong life at age 50 by 14 years for women and 12.2 years for men. And I want our listeners to be clear that these are 14 years beyond those added to the years that people would expect to live who are not practicing those behaviors. So at life expectancy at age 50, for those who are not practicing none of the behaviors or who are achieving none of the factors, was 29 years after the age of 50. So that's 79 years in total. For men, it was 25.5 years. So a life expectancy is around 75.5 if they're achieving none of the lifestyle behaviors. What this study showed was that for those who are practicing all of those behaviors or practicing or achieving all the lifestyle factors, their life expectancy is about a decade longer than what would be expected if they were not practicing those or achieving those lifestyle factors.
Now, one of the major findings in the study was about something called the population attributable risk of non-adherence to the 5 lifestyle factors. So that's kind of a very statistical term. Can you share with us what that means and the numbers, what they actually found related to this population attributable risk?
So population attributable risk refers to the percentage of a certain condition that you can eliminate if you eliminated a certain factor or certain behavior. So for instance, an example we can give is if you eliminate smoking entirely amongst women, then what percentage of lung cancers amongst women can we get rid of? Right?
Okay.
So that's population attributable risk. So in this study, they looked at the population attributable risk of eliminating the non-practice or the non-adherence to these 5 lifestyle factors.
Okay, got it.
So like you had mentioned before, many individuals are not practicing any or not achieving any of the lifestyle factors, right? So if we eliminate that, right, and as in we start to get everyone to achieve those factors, what percentage of these chronic disease or death from these chronic diseases can we eliminate? So what the study found was that if we can get everyone to start achieving all 5 lifestyle factors, it would eliminate 60.7% of all cause deaths. So death from any cause, all cause mortality. It would eliminate 51.7% of cancer deaths. And get this, 71.7% of cardiovascular mortality.
Wow.
That's amazing. So if we can get everyone to start practicing or achieving these lifestyle factors, all 5 of them, we can eliminate 71% of deaths from cardiovascular disease.
Wow. And on a population level, that's massive.
Well, that's thousands of individuals, millions upon millions of dollars of healthcare expenses saved. I mean, these are huge numbers. I mean, look, and 71% is huge, but look at cancer. More than half, 51% of cancer deaths.
I mean, that to me sounds like a really important and big finding, especially since I'm sure we all and many of our listeners, we know somebody who maybe passed away from cancer or heart disease, and but I read somewhere from one of these news outlets who reported on the study they quoted Dr. Dexter Sherney, who is the current president-elect of the American College of Lifestyle Medicine. And Dr. Cho and I were both members of ACLM. He made a rather curious statement. He said that the study findings are not groundbreaking. And almost kind of sounds a bit of like a downer statement, given all the hype around the findings of the study. What do you think about his statement? Or do you agree with them? Or
well, the word that he used was groundbreaking. I mean, I would agree. If is the study significant? I believe yes, because it keeps on adding evidence to our conviction that lifestyle, the way that you live your life, is important to health, right? And this study, looking at a very large population sample, followed over many years, coming out of a place like Harvard, I think is significant, right? It's just because it's adding more evidence to the cause of lifestyle medicine. However, I agree that it's not groundbreaking. We've had studies before, the Adventist health studies and other studies that have looked at longevity and have shown very clearly that lifestyle, the way we eat, the way we exercise, and other things like that are very important. So it's not groundbreaking for sure. So I would agree with Dr. Sherney there. I think it's significant, but maybe not groundbreaking. So
what I think is that what this study shows is that how long how much more the greater the life expectancy is if you follow these healthy lifestyle habits.
For sure, yeah.
And over a decade, that's a lot.
Exactly right. And we didn't mention also the decreased risk of mortality for different conditions. So in this study, I mean, the numbers are absolutely stunning. 74% lower risk of mortality from any cause. 74% lower risk of mortality from any cause. 65% lower risk of death from cancer. 65%. 82% lower risk of death from cardiovascular disease. So it's not just extending your life, but it's the study is showing that the risk that you would die from cancer, from cardiovascular disease, from death from any cause, these are going down, and not just by 20%, 10%. This is like 74%, 65%, 82%. These are huge numbers. So this is a very significant study.
Yeah, I would agree. And so if we this podcast is about lifestyle medicine. And so what significance do you think the findings of the study have for the area of lifestyle medicine?
Yeah, I think it's not that lifestyle medicine, the field, doesn't have enough studies. I think there's so much compelling evidence, Daniel, for us to go out there and with conviction talk about why lifestyle is so important to health and to the practice of medicine and so forth. So it's not that there's a lack of study, but this study, it just, like I said, it just adds to the weight of the evidence. And I think it adds a lot because of the numbers that were the results from the study. The numbers are so high that it's so convincing how important lifestyle medicine really is to those who want to live longer and lower the risk of dying from various diseases. This study really adds compelling evidence to the argument. So I think that's how it contributes to lifestyle medicine.
And if I could just add something, the authors make a sort of a clarion call. Of course, they're not the first ones, but they make a clear call for the need to prioritize prevention.
Right.
They quote, they say here, just reading from the study, that prevention should be a top priority for national health policy. And this certainly aligns with lifestyle medicine because prevention is one of the core principles
for
of lifestyle medicine.
Prevention is huge for us.
Right. I think that one of the most encouraging things about this study is that the 5 lifestyle factors that were studied are all things that we ourselves can apply, right? We can all choose to eat healthy, to stop, or or never start smoking, to drink alcohol moderately, to exercise regularly, and maintain a healthy body weight. These are all things that that are within our power to do. They're not saying that they're easy, but they're in our power to do, and I think that should be really encouraging for our listeners. For sure,
yes, for sure. These are all things that we can do. We might need some support in doing different things or achieving different things, but for sure, these are within our power. And the beauty of all this is that you don't need a prescription, you don't need to go to a hospital, you don't need to go to a clinic necessary to do many of these things. These things are things that the individual themselves can do and can achieve, right? Even though support is maybe necessary in certain cases, but really the power is really in the hands of the individual. If you want to get a surgery, you must go to a hospital, right? I mean, you're not going to do surgery on yourself. But exercising, I hope not, yes. But exercising, eating healthier, right? Eating more fruits and vegetables, eating less refined sugar, not smoking, alcohol, moderating our alcohol use. These are all things that we can do. So I think it's really, really, really important for people to realize that it really puts the power in the hands of the individual to take their health into their own hands, into their own control. So that's really important.
Yeah, and that's, for me, that's one of the things I really love about lifestyle medicine. It empowers the people, with just with the right information, a bit of education, and maybe with some support. We can really take our health in our own hands, and I think that's just amazing.
And Daniel, I know that we have a podcast that's coming up, but in North America there is a population group that's actually practicing or achieving all 5 factors, right? And it's called a blue zone, so they're actually an example of a population group right here in North America that are achieving these lifestyle factors. And as a result, studies have shown that they are actually living longer than even the Japanese and the average Americans. So I think, and I know we'll probably hit on that topic in later podcasts, but just want our listeners to know that we'll be covering a population group right here in North America that are achieving these lifestyle factors and living longer and living better because of it. And this should be encouraging to us to realize that, it can be done, right? North America is not a lost cause. It can be achieved even here in North America. So,
right. Yeah, definitely. We have a podcast coming up about that. And they're actually one of the longest living people groups in the world.
That's right. Even longer, like I said, than the Japanese, who are generally seen as those who live the longest, right? But these individuals living in Loma Linda, California, they're living longer than even them. So,
right,
on average,
yes, of course. Yeah, and just for our listeners, by blue zone, and correct me if I'm wrong, but by blue zones, it's referring to a certain area with very high percentages of centenarians, people who live up to 100 years old.
That's right.
It's really remarkable in North America with our, very unhealthy food environment, an environment that promotes sedentary lifestyles, pollution, what have you. We have one of the longest living people groups in the world. They practice, generally speaking, all 5 of these lifestyle factors. They don't smoke.
That's right.
It's very discouraged. Alcohol is also discouraged. They eat generally plant-based. They are generally trim. And what was the 5th one again? The last one? The
not smoking.
Yes, right. Well, smoking. I think we covered that. And exercise, right?
That's right.
Exercise is promoted as well. So yeah, we have a podcast episode coming up about that. And why don't we close off this episode by just just a few tips on each of the 5 lifestyle factors.
Sure.
So let's start with healthy eating. So what should our listeners focus on when we think about healthy eating to promote longevity?
For sure, yeah. I mean, we could have a whole podcast on healthy eating and multiple episodes, but I think a general rule of thumb is to eat whole foods, plant-based, right? So a vegan, vegetarian diet that's focused on whole foods, low amounts of animal foods or none, if at all. And I think this is really important for our listeners to eat, to eliminate or reduce the amount of refined foods. So this is foods that are made in factories, that comes in packages. You want to get the raw nutrients and transform them yourself by cooking at home and eating that way. I think that's much better than eating pre-cooked, pre-made foods from the factory. So I think that's another factor. I think those are general rules of thumb to start on a path to eating healthier.
And how about exercise?
Exercise is really important. If we look at the Canadian physical activity guidelines, the basic guideline for adults is 150 minutes of moderate to vigorous aerobic physical activity. So this is aerobic. So this is things that get the heart beating, right? And it's enough. It's intense enough for you to breathe a little bit harder, or be out of breath, and to sweat a little bit or to sweat a lot. So that's kind of a general rule of thumb for people. And to just give people a gauge, brisk walking would be considered moderate, whereas jogging would be considered vigorous. Yeah, you don't have to run marathons, do the Tough Mudder. You don't have to do this kind of stuff. It's 20 minutes of exercise or activity that gets your heart going, breathing a little bit harder and making you sweat a little bit. So that's what we're kind of looking at here.
And how about maintaining a healthy body weight?
Again, this is a huge topic that can take up a whole episode, multiple episodes. But what we're looking at here is achieving a healthy BMI. So in this study, they were looking at 18.5 to 24.9. Individuals can go on Google and put in BMI calculator to calculate their BMI, which is factors in two things: your weight and your height. And basically, it talks about, it's a measure of, for your height, are you at a normal weight, right? And so you want to achieve or aim for a healthy, normal BMI. And some rules of thumb in terms of achieving weight, healthy weight, is to first focus on the way you're eating. A lot of people, they don't want to change the way they eat, so they start exercising. Well, you can never outrun a bad diet. That's just a fact. If you're eating bad, don't think you're going to go outrun that thing. So you have to change your diet first. And a whole foods, plant-based diet, low on refined sugar, refined carbs, low on the junk food, that is your best chance of of achieving a normal weight. Eating a large breakfast, very small dinner, eating at regular times, not snacking in between meals. These are some very simple tips for people to start on a course of starting to shed some of those pounds.
And lastly, how about tobacco and alcohol?
So for smoking, in this study, they said they mentioned how it's better not to smoke, never smoking, right? So I think that would be the recommendation I have for people, is to not start smoking at all. For those who are struggling or who want to quit smoking, there are great programs out there and resources out there. Definitely speak to your medical doctor, but one program that does come to mind is the Breathe Free program. I believe they have a Breathe Free number 2 now that's out, and it's a program that helps individuals stop smoking, and it's out of Loma Linda University in California. And I think that's a great program that I could recommend for individuals who want to quit smoking. But obviously, the best thing to do is to not start at all. Regarding alcohol, It says a moderate alcohol. That's the word that's used. That's the phrase that's used in the study. I think our listeners have to be very it's important to emphasize to our listeners that this doesn't mean that you should start drinking moderately if you're not drinking. Right? So that this guideline is for those who might be drinking too much and saying, hey, if you're drinking too much, cut back. Right? It's not to say if you're not drinking, then you should start drinking to get at a moderate level. No, there's no single guideline out there that says to tell people who are not drinking to start drinking. None. So I think that's really important. I believe that the best thing is to abstain from alcohol completely. It's not a necessary component of your diet, and all the benefits of that people can get from alcohol when it comes to your heart and these other things, you can achieve through eating a whole foods plant-based diet. So my recommendation to individuals is to not start drinking at all. If people are already drinking, to achieve at least a moderate level, which is no more than 1 drink for women per day and no more than 2 drinks per day for men. But also strongly consider just completely eliminating alcohol from your dietary patterns. So I think that would be my recommendation to individuals. If people have an alcohol problem, as in, there's some addiction, things like that, then they really should seek more higher level medical support, speak to a health professional.
Well, we'll have to leave it at that for now. So thank you, Dr. Cho, for taking us through that study. And for our listeners, as I mentioned, we'll be including a link to the study on the podcast page so you can go and read it for yourself. We'll also be covering each of these lifestyle factors in greater detail in future episodes. So we hope you will join us for that. So thank you so much for tuning in today. Please do leave us a review and feel free to share your suggestions with us on what you would like to hear in future episodes. You've been listening to the Lifestyle is Medicine podcast. Hope you'll join us next time.